Welcome to the Quality of Life podcast, where we explore how hospice and palliative care may enhance quality of life for patients living with a serious illness. Here's your host, hospice and palliative care leader and educator, Dr. Millicent Burke Sinclair.
Hello and welcome to the Quality of Life podcast. Today I'm here with Chris Comeaux, President and CEO of Teleios Collaborative Network and Teleios Consulting Group. Thank you so much for being here, Chris.
Thanks for having me, Millicent. It's so good to be here with you.
Well, before we get started on our topic today, I would really love for you to share with the community about your background with Four Seasons, because it's really incredibly special. And I think it could help connect with what you're going to talk about today.
Yeah, I feel like in many respects, I grew up at Four Seasons. And so I joined in 2002 as the president and CEO, and I was there till 2006. I left for 2 years, came back in 2008. And then in 2017, we launched Teleios Collaborative Network. And you succeeded me in that position. And now I'm over at Teleios. And in many respects, I feel like, Four Seasons has blessed me in so many different ways. I mean, I think of all the patients and families that Four Seasons has served over the years, literally the tens of thousands. But it also changed my family's life. I mean, we took a interesting kind of leap of faith of moving here when Four Seasons was only serving 30 patients a day, but we had our Elizabeth House. The board of directors had this amazing vision that this literally could be one of the top hospices in the United States. And so my wife and I loaded up the truck and we moved to Hendersonville. We had a 2-year-old and a 2-month-old at the time, left family in Pensacola to move here and fell in love with this community. Fell in love with the amazing team at Four Seasons, and to look back through now our history and just seeing all the amazing work, seeing the great work that you and your team are continuing now. I mean, it just really makes me smile. And I even have a family member now working for Four Seasons, so like the next generation. So Four Seasons is near and dear to my heart. This community has always been near and dear to my heart. And what I've always loved about Four Seasons, it is such a critical part of the community. The whole Henderson County community whole Western North Carolina community has so just many amazing, beautiful little small towns connected to the history locally. But Four Seasons has really infused itself with that community, the volunteers and the many donors over the years. It's this beautiful symbiotic relationship, and I'm honored that my family and I have been a part of that journey over the years as well.
I so love listening to what you're sharing, because as you're talking, you can feel the passion behind what you're saying. And it makes me connect back to your reference in 2017, the transition, because you launched into something that was innovative, that was almost like uncharted territory. And our board believed in it and supported it. But you had that vision. And I'd love if you would just be willing to share with the community, what is TCN?
Sure.
Because I'm sure that the community may see it on our website or might hear it sometimes as we mention it. But what I want the community to realize is that Four Seasons, as incredibly dedicated to our community, believes and realizes that nationally there's a lot changing in healthcare.
Yep.
And so we have to make sure that we not only support our community with excellence, we have to continue to learn to be able to do that. And that's where TCN helps, not only us, but so many across the nation.
Gosh, I love that you said that, Melissa. So I'm going to tell a little bit of a story, because I think that, when you're part of an organization like Four Seasons, you kind of forget where you begin and it begins. Like you so intertwine with each other. I could remember on my job interview at the Elizabeth House, sitting in the chapel, and Jean Hoekstra. And one of the things that I literally sat there befuddled, and she told me how Four Seasons intentionally did not become Medicare certified till the mid-'80s. And I remember sitting there and going, that's crazy. But then I would tell that story over and over again, because what I started to learn, because the story she was teaching was there would be a box around who we can serve. In other words, Four Seasons saw into the future and saw really a future of palliative care. Yes, there's a positive benefit of having a Medicare hospice benefit, but there's future innovation. And so what I would always say, and you remember this because you and I talked about this the very first time we met, that this thread of innovation is literally in the essence of who Four Seasons is. Not innovation for innovation's sake, but innovation to make sure that Four Seasons continues to evolve, to make sure we're here years to come. And I feel out of that thread is really where Teleios was born. And so our board in about 2012, we did a big strategic planning process, and we saw these storm clouds related to reimbursement. And We've got one interesting example with an area where you see an organization sold to a large for-profit as kind of their solution. We went the total opposite way. In fact, we kind of figured out there were 3 options. You could sell to a for-profit, but that would be a betrayal about all of our history and this amazing covenant that we have with the community as a nonprofit. Second option was maybe merging with a hospital or healthcare system, but we saw they have their own challenges, and we want them to be able to concentrate on what's most important to them. And we didn't see many examples where that worked out well, where the hospice thrived and created a very innovative organization for the community. So that left us with this really interesting third option, which is how do we get other nonprofit hospices to stay local, stay independent, stay separate, but then create this really interesting way where we could collaborate and become part of something larger to do things like negotiate with future payer contracts, like literally have the best of both worlds. And we invented that in Teleios Collaborative Network. In fact, a lot of people try to say, well, help me understand what it is, because we go with things that we kind of know. Yeah. So think of TCN as like an association, a clinically integrated network, which is probably beyond today, but suffice to say, it's a bit of a kind of a safe harbor for nonprofits to collaborate with payers, basically, to act as one, but still stay separate. And then a consulting group. Yeah. And so kind of woven together. So bringing all these interesting tools so programs can thrive, quite like Four Seasons has thrived over the years. In fact, I like to say that in some respects, I don't know if the community realizes how special this gym it has in Four Seasons. And, I've spent a lot of my life's work, working with the team, and now you're carrying that forward. But not every community has this amazing program like Four Seasons when you look at the comprehensiveness of that continuum of care. So in some respects, I feel like TCN is helping do that across the United States now. And we're actually in 10 different states. We have 15 different nonprofit programs. We have another 35 working on the consulting group side. But those core TCN members, and we've grown quite a bit from the early days, and we look forward to keep serving more and more people in the future.
One thing that I absolutely loved that you just shared was about the growth that TCN is having. And it's not growth for growth's sake. It's growth because you truly believe that every single individual deserves the very best care, period. And so in my mind, that's what I think about when I think about TCN. TCN is helping to strengthen and shore up the ability for every organization to be able to provide that high quality care. And what I am so grateful for at Four Seasons is that, Four Seasons is a tremendous organization. But with every organization, we always have room to learn. We always have room to grow. And in fact, you were sharing about the size whenever you became the CEO. And I think back about the size that we were, or the amount of people that we were serving whenever I became CEO. And now what a blessing it is to think we're really, truly fulfilling our mission of co-creating the care experience, because we're serving more patients and families than ever in our history. Yep. And we're not doing it alone. We're doing it because our community believes in the great work, and we have TCN that helps to make this possible. So I want to say thank you to you, because, when I think about it as the CEO, our community, those that we serve, those that we partner with, and those that we employ, they deserve the very best. Yep. And so I'd love if you would share with us just a little bit about what are you seeing nationally in the end of life in the serious illness space, because we realize, again, our community deserves the very best care, regardless of their ability to pay. And that's something that Four Seasons has been dedicated to for many years. But the reality is, healthcare is changing and challenges are existing, but we don't have to do this alone. And our community can be 100% confident that Four Seasons is here to provide the best care, regardless of what's going on around us. And TCN is our partner to help us with this.
Yeah, let me share a couple of things, Millicent, and you're going to see in a lot of things I'm going to share, things that Four Seasons has innovated. First off, palliative care I feel like palliative care is finally coming into its own. I could remember in 2002 and the early debates about what is palliative care, et cetera. Well, many people are trying to launch palliative care programs. In our Teleios network, we're helping many programs who don't have palliative care spin those up, birth those palliative care programs from the ground up. A lot of people are looking at kind of private duty. Four Seasons has Four Seasons Home Care.
Yes.
When people actually see, like, Well, what if I need some additional, like the caregiver is maybe as frail as the patient? I need additional support in the home. So having a partnership or your own home care program, a lot of telemonitoring and telehealth, again, kind of creating, it's hard for that caregiver. So can we create a safety net around that patient so they can maintain in their home safely? Care navigation. And so there's a lot of flavors of care navigation. Four Seasons has a beautiful care navigation program. But what I love is what is old is new.
Yes.
And so great hospice care is so important. I think maybe a little bit later, you're going to ask me about kind of things nationally, but I'll give you a little bit of teaser. When I came into hospice in 1995, 75% of hospices were nonprofit, 25% were for-profit. That is now completely flip-flopped. 75% of hospices are for-profit, 25% are nonprofit. And the reason why I'm bringing that up, not every for-profit is bad, but there are a lot of people that are in this business to make a buck. They're not there to do the care that you're talking about that is amazing for the community. And so returning to great hospice care, any business you're in, you should want to provide a great service, great quality, do it in a timely manner, and you want to do it at the most efficient and kind of cost-effective possible. That should be true of any business. Unfortunately, there's some people in the hospice business that is not true. So getting back to great hospice care, and I know that's kind of been a theme of yours the last couple of years. And then just the last thing is just very responsiveness. And so when people are dealing with a serious illness, they want people to be responsive. If you have a patient that is in a crisis situation, pain, symptom management. I talked to a guy who is a well-known person, a national kind of medical director. And he's now retired, and it was his stepdad. Horrible pain crisis. The family was up for 48 hours straight, and he had to fight to get good hospice care. And he knew about hospice, but he had to fight to get it. Where do you typically have to fight to get a service that you need? I mean, usually you just call and there's people to do that. And so I think going back to kind of some of our basics are pretty critical.
Well, one thing that I believe that you said is very important is about a safety net and remaining in the home wherever one calls home. So with Four Seasons, we really want to remove the burdens of a serious illness or end of life, because we realize that patients and families are feeling extra burdened by what they're going through. And while we might not be able to change or reverse the diagnosis, we can certainly provide that safe, supportive, caring care. And every single individual that's a part of Four Seasons has that same genuine commitment. And what I loved about what you discussed is you were just sharing about our services that we offer. And we don't offer them just to offer a service. We offer them because that's what the community needs and deserves. And so, as community listeners, I would like to just encourage you, if you're like, you know what, I'm interested in what I heard, but I don't even know what to do next. If you don't know what to do next, really just pick up the phone and call us, because that's all you have to do. When Chris talked about care navigation, we can help go alongside of you to navigate next steps and next options. The other thing that oftentimes we hear is, well, if I decide to pursue palliative today or hospice today, I'm scared that I can't get out of it. Yeah. No, you can make a decision at any time to seek care or to stop. And at Four Seasons, we want every person to feel well supported and confident in their choices. And so we spend a lot of time with our staff and our volunteers to make sure they're well trained and they have the support that they need, just like caregivers, because, it's a challenging time when you think about having a diagnosis or trying to figure out what to do. And so when we talk about challenges and figuring out what to do, Four Seasons is right there. And again, can provide that safety net, if you will. But that's also something that TCN is helping to bring to organizations that provide this type of care all across the nation. And nationally, there are changes. And nationally, there's things that we're hearing about. So I wonder if you might be willing to share. We already see how Four Seasons is continuing to stay innovative, which I'm going to use a different word to connect with the community, maybe relevant for the community needs, because we generally care about what does the community need. Yeah. And we want to listen and be able to be prepared. And you help us to do that. So can you talk a little bit about nationally, what might the community want to know about?
Yeah, I'll definitely talk about several, Millicent. First off, reimbursement challenges.
Yeah.
And so, Medicare is not exactly trying to figure out how to pay providers like Four Seasons more. They're making it more and more challenging. And also, we all know inflationary times. I mean, we just go to the grocery store. And Four Seasons, like any organization, is dealing with inflationary expense pressures, but yet we have no corresponding revenue increase. Right. And so let me go through the challenges, and I'll kind of speak then how we're working on those things together. Consolidation. I mean, just look throughout the hospitals. You have local hospitals here. They're no longer independent. They're part of something bigger that's happening nationwide. In fact, they say that if a hospital is not part of at least a $20 billion with a B dollar healthcare system, it's difficult for them to survive. You're starting to see that kind of spill over into the hospice industry. That flip I talked about earlier, large amount of for-profit providers. Again, not all for-profit providers are bad, but there's another thing kind of behind that for-profit thing. There's a lot of private equity-backed for-profit hospices. And if you I don't need to get into a lot of detail. We actually have an interesting podcast coming out soon. A woman wrote a fascinating book called Ethically Challenged, where she's pulled the veil back on what's going on in the private equity world. But suffice to say, these private equity funds are just trying to make money. And they really don't care what they're in the business to do. Not only is it affecting hospice, it's affecting dentistry, air ambulance, autism schools. So private equity is coming into hospice quite a bit. And then the downside to the typical consumer is you might see this beautiful commercial and you have no idea that what's behind that commercial is horrible care. You don't know, it's just a select commercial. Whereas an amazing organization like Four Seasons, you do a great job with your marketing, but then to know that there's great quality care behind that, and that is true. Whereas some organizations, that's not true, especially some of these private equity-backed ones. One thing I was reflecting as you kind of gave me a heads up on this question, I can remember coming into this community in 1995 and many independent physicians. There are less and less of those independent physicians anymore. There's still a few, but they're not a lot. And so now they're part of some broader system, whether it's a local hospital system or some broader physician group. That's a big change over the years. Nursing homes and assisted living facilities experience a lot of change. They're going through a lot of their own challenges within healthcare as well. And that just makes it more and more difficult if family members are like, I don't understand what's going on within my local nursing home area left. They've got a lot of these same challenges, but even like worse as far as like to the factor that is ratcheted up on them. Staffing shortages throughout all of healthcare. People have talked about the aging of America as a silver tsunami. That is just starting to hit, and the biggest years are in the future. So staffing shortages, this is why, Four Seasons being one of the best places to work in America is so important, because you want to attract the very best workforce, because there's a limited amount of workforce. And then all the while, when I kind of reflect on all of those things and then kind of bring it back to Four Seasons, those are big challenges, but the very unique way today that we're navigating those things together. That's really what Teleios was founded for. And it's not that Teleios has all the answers. It's working with the amazing leadership team at Four Seasons. It's why we actually put collaboration in our name. We're collaboratively figuring that out together.
Oh, that's perfect.
And, you get, Millicent, get to work with a lot of other people within the network. And one of our favorite adages is we really are better together than we are individually, where we share those best practices. As Four Seasons figures things out, you pay that forward to other people within the network, and then vice versa. That's just the beauty of kind of what we're doing, is we create this interesting ecosystem of beautiful programs like Four Seasons that we're navigating each and every one of these things. And it all comes back to what happens by the bedside for patients and families here. It's pretty unique. Maybe they don't always realize it till they go to another community, but they're really blessed to have a Four Seasons in their community. And I'm working every day to make sure there are other communities that say the same thing.
As I'm thinking and processing on what you just said, there was a statement in there where you referenced about us being a best places to work and number 9 nationally. And wow, I am so proud of our team, because it takes every single person working together to co-create. And when I think about my 10 years now being at Four Seasons, it's pretty amazing. But, you instilled early on that commitment to our community. And then whenever I think about our commitment to community expanding as we have over the years, what continues to be most important is people.
Yeah.
Just people. and providing excellent care to people. And so oftentimes I tell, our employees or our volunteers and even our community that, we are dedicated to providing excellent quality of care to you. And it starts with our employees, because what we realize is if we're going to commit to the community to provide the best care, we've got to do that with our people who are providing the care. And that's every person employed with Four Seasons. And, as we've continued to serve more patients and families throughout our communities, we've continued to add more employees. And we're so grateful that more volunteers have wanted to be a part of this. More donors have said, hey, I want to be a part of making this possible. So when I think about employees and volunteers and donors coming on board to say, hey, we're going to be ambassadors of co-creating the best care for this community, it makes me think about a question that we've touched on a little bit, but I just wondered if you had anything else that you wanted to share regarding healthcare change over the years and maybe what our community could be thinking about, in a sense, have a reassurance that Four Seasons is going to continue to have their very best interests in mind.
Yeah. Well, first of all, I think what you just talked about, Millicent, I mean, your employees are your greatest asset.
Absolutely.
They are the secret sauce.
Yes.
And if I'm sitting there as a listener in the community, then it's like, how can I help that?
Yes.
Maybe it's not today that I have a loved one that needs it, but I want to make sure one day you will be there for me. And so volunteering, donating, sometimes just letting the staff know that they're heroes.
Yeah.
I mean, they really do walk upon sacred ground. And so there's so many different ways you could get involved in Four
Yes.
Seasons. And, one of the quotes, Millicent, we use over the years is, I have stood upon the shoulders of giants. And I think about the giants that I got to stand upon, the forefathers, foremothers, like the Gene Hoeksters and many of the folks that started Four Seasons, and now how you and your
Yes.
team and your board of directors, but we have such a rich history. And I think that's that continual connection of the community becoming part of Four Seasons. Yeah. Four Seasons is the best part of what a community is about. I'll get a little kind of philosophical on you because, I'm a little bit of a history geek, but they did an interesting study and they said that, the best indicator of a society surviving into the future is what a society does for the people who can't do for themselves. And when I think of what Four Seasons has done over the many years, I mean, literally tens of thousands of people,
Yes.
and the hundreds of thousands, you think about the patients' families that have been impacted. And that's always been Four Seasons why, the core of
Yes.
it. And if I'm someone in the community listening, I got to go, wow, that's amazing. I want to be a part of that. And there's so many ways they can be a part of that. And then also at some level, breathing well to know, what, Four Seasons is working to make sure they're here many years into the future. They're doing innovative things. Their board is thinking about these major challenges. I mean, we're alive at a very challenging time in healthcare as a whole, but just smiling and knowing, but you know what, I want to be part of this organization because they're really a lot different compared to others.
You're right. One thing that is really significant to me that you shared makes me think about our strategic planning process. And, for the community to be able to know, what, I'm investing, I'm trusting, I'm supporting, I'm reaching out to an organization that is not just here for today or here based on past. We're here for 40, 80, 100 plus years. And the way I can say that with confidence is day in and day out, we're focused on what's most important, which is providing excellent care to our community. And so when I think about the focus around putting people first and listening to people. So again, people meaning those we serve, those who provide the care, and probably many other fill in the blanks there. But when we look at strategic planning year over year, this is 3 years, 5 years, 10 years and beyond, we say, all right, what's going on that we need to be aware of externally? What's occurring internally that we can do something about? And then what are possibilities? And so our strategic plan, though, is rooted in being the best place to work and the best provider of care. And those two things together is our commitment to the community, that we're going to provide the very best care no matter what's going on around us. And this is where I think that TCN, we're so incredibly blessed with the partnership with TCN because we couldn't necessarily do what we do alone. We have tremendous people. But there's always change and there's always more that we need to learn and grow. So when we think about getting ourselves keeping ourselves and furthering ourselves, meaning our mission, so that that co-created care can continue. I wonder if there's anything in the realm of funding, healthcare change, or positioning that you see occurring nationally that would be important for the community to be aware of.
Yeah, well, a couple of those that we kind of we alluded to, Millicent, is just the challenges of, the government is not paying you more. That's not keeping up with your expenses. And I love everything that you just said, because at the end of the day, the community really can take faith in that Four Seasons is preparing for the future. Part of my job in TCN is I got to be looking out to those 5 or 10 years so I can report back to you to say, Millicent, here's what's coming, prepare your organization, and then you and your team do prepare. If I'm a donor, that's the type of organization I want to give to. And as a nonprofit, that whole fundraising realm, that is part of the secret sauce and superpower. And I love that beautiful circle where, someone can give out of their heart, out of their abundance, and know that they're investing in an organization like Four Seasons that is doing so much great good for the community, but then also doing good to be here into the future. And so I think that's an area where, as nonprofits, it's part of the potential secret sauce. And, we're alive at a very interesting time. The baby boomers have done brilliant things throughout their careers. And I think there are many of them looking to go, who can I invest in? And I think they think of it in that way. And but I love your one of your keywords constantly with your team is stewardship.
That's it.
And it's a beautiful word because it says, we're going to steward every resource you give us, and to the essence of what we've been talking about, to make sure that care is amazing today and an amazing into tomorrow. So yeah, there are a lot of funding challenges. I mean, there's the whole commercial payer world. I mean, we thought that maybe Medicare was going to carve in Medicare Advantage. And what that means is today hospice is carved out, and I don't want to get too technical, but just suffice to say, all of a sudden an organization like Four Seasons could wake up and all of a sudden the payer is United Healthcare. And so that is a scary thing that we've been preparing for. And so again, it kind of comes back to, and the best way that we prepare for that is everything we've been talking about. High quality of care. TCN is trying to take all of this network of organizations working on a high quality of care and saying, hey, payer, we're a cut above. Partner with us, contract with us. And so I would want the community to know that's why Four Seasons is part of someone like TCN, is so that way it's positioned in the future, regardless who the payer is going to be. So that way people throughout this community are going to get the best care possible.
It ensures access to care for them. I think that if I was a member of the community right now, I would be saying, how can I be a part of making that care possible? And how can I ensure that that trusted care is available when I or my loved one need it? And that's something that we're talking about today. And we'd really encourage you to go to our website because there's so many ways to get involved. And sometimes it's as simple as writing a note of gratitude to all the volunteers, the donors, the employees who are furthering this commitment to our community. But you might want to go further and volunteer or become a donor. One thing that I think about is our board members. Our board members are such a tremendous gift because our board members represent our community. Our board members are from our community and throughout all the counties that we serve. And what's really powerful about that, I think about roles that you hold or I hold, whether we sit on a national board or a national committee, we're there to learn and to contribute. Well, our local board members are there to learn and to contribute. They're bringing wisdom and passion and commitment. And so I want our community to realize that Four Seasons is here for each member of our community. And we're open to listen and to learn and to grow and meet needs even better. And so when I think about my own story, I have many hospice and palliative related stories, but one story, I was a member of our community and a loved one of mine was served. And they actually happened to be one of our first patients in our inpatient unit. And I've told this story before because what so stands out to me is the tremendous care that, yes, my loved one was provided, but so was I.
Yeah.
So was the rest of my family. And sometimes, I don't know, but if you're just going to normal appointments, if maybe that relationship is with you and the provider, but what about your family, especially in a serious illness, especially with an end of life type of situation? And so it stood out to me all those years ago that the employees genuinely cared, and volunteers, because they came and offered us water. They came and offered us food, but they genuinely cared about us. And we've continued to pay that forward. And so I just want to also encourage the community to say, you are not alone. We are here for you. And realize that, what's most important to you is likely that your loved one or yourself are well cared for. And you can trust that when you choose to call Four Seasons, we're going to listen to you and we're going to provide the very best care possible. And that means listening to you every single time that we're with you, not just listening the first time, but listening every time. And so when I think about TCN and I think about the value of listening to provide the best care, I'm reminded of something that is really near and dear to my heart, but it's our Teleios University, where we're paying forward to leaders all throughout the nation. They can come to be a part of leadership immersions and growth immersions and hospice immersions. And so wondered if you want to talk about that, because again, if I was a community member and I might say, you know what, I don't have someone who needs the care right now, but I want to learn about how to get involved. Or maybe I do, but I want to know that the person providing care is being well trained. Could you talk a little bit about that?
Yeah, when you think about our model, Millicent, well, in fact, let me contrast our model maybe compared to other models. I'm not dissing Walmart. Walmart's a great member of the community, but as an example, people call the Walmartization of America, kind of a box approach, kind of a top-down approach. Our approach is the opposite of that. It's more of like, you think of your local store that people know you, et cetera. So we're about kind of, it's an upside down approach. It's all about empowering the local organization. So if that's the case, then we're investing in the local people. It's all about leadership. One of my heroes is John Maxwell, and he says, everything rises and falls on leadership. So we spend a ton of time, energy, and effort of bringing world-class leadership training to all the people throughout our network. You and I even have a one-year leadership certification course where people are going through a course where they're literally saying, this has changed my life. I'm a different person. And if I'm a different person, whatever my job is going to be even better than it was before. And so it's all about, you keep saying it, it's all about investing in people. That really is the most important thing. And when I think about contrasting compared to maybe other businesses out there, this is sacred ground that we're walking on. And I remember, when you and I met the first time, and your passion in your heart of, this has changed my life. I want to be a part of this. And it's a beautiful story. There's many people like you in Four Seasons that have that story. There are many volunteers and board members. And bringing that together, it is almost magical, because a group of people that are that passionate and then bringing care back into the family. And you alluded to the fact that it's not just about the patient, it's the family as a whole. And when you were saying that earlier, Millicent, reminded me, years ago, we had this fundraiser and this woman pulled me off aside. It was a fundraiser for Four Seasons. And she literally shared with me, and she said, the care that Four Seasons provided will change the rest of my life.
Oh, say that again.
And so she said, the care that you provided will change the rest of my life. And she told this beautiful story. Her mom had gone through research at Four Seasons. She had been part of Palliative Care. She had been through the home care, and then she had died in the Elizabeth House. And before her mom passed away, she brought each of the kids in, and it's almost like she spoke like a blessing over them. And she said, I heard words that I desired to hear my entire life, but didn't, but I heard on my mom's deathbed. And she looked at me and I'm in tears. She goes, this will change the rest of my life. And that was a beautiful moment of this is what Four Seasons does. This is what really great community-based nonprofit hospice does. It does an amazing job for the patient, absolutely, but the family as a whole, and people's lives are impacted. And then when you get those people coming back into the organization in various roles, boards, volunteers, team members, you've actually had board members become now team members. It really does create something special. And it's, Tina Gentry, who's a team member of mine, she worked at Four Seasons many years. She had this great talk she would give at Rotary. And she'd say, you know, when you hear about hospice, you understand it. And I know our listeners are listening. I'm pointing to my head. But once you experience it, and she would kind of cross her hands over her heart, you understand it in a whole different level. And I feel like that's what we're describing.
You're absolutely right.
It's hard to put into words, but whenever people do experience it, they then want to be a part of it for the long term and in various ways that you allow them to be a part of it.
You know, every single person deserves respect and compassion and tremendous care, whatever stage of life they're in. And that's something that gets me, kind of woken up inside, because the truth is that we get to do that. We get to make sure that people are genuinely respected and really well cared for with compassion. And, you know, I would encourage listeners, if you're saying, you know what, I want to be a part of this. I either need access to the care for a loved one for myself, or I'm feeling connected here. I would encourage you to go on to our Four Seasons website, but go ahead and check out Teleios' website too. So Teleios' website is pretty simple. It's TeleosCN.org. Now, Chris will probably say there's a special way to spell Teleios. I'm going to spell it. It's TELEIOS. CN.org. When you go on, you can read more about what Teleios is doing nationally, as well as how Four Seasons and our community is benefiting. Likewise, I'd love for you to go on to our website if you've not visited it before. And it's simple, fourseasonscare.org. And I'd like for us to remember that all throughout Western North Carolina, we are committed to caring for every single individual. Whether you need care now or you need care later, we want you to feel cared about and know that you're not alone in whatever place in the life journey that you are, but we're here for you. And so, Chris, within our final time, I just wanted to know if there's anything else you'd like to share with our listeners.
I think what you just said, Millicent, I was thinking that quite often people are hesitant, and unfortunately, sometimes maybe they get experiences in healthcare that makes them maybe not as trusting. This is an organization you can trust. Pick up the phone, just call them. They will come alongside you. You may, well, I'm not sure which program. Don't worry about it. Pick up the phone, call them. They have a beautiful continuum of care that a lot of other communities don't have. So you call them. They have more resources, and more often than not, when you look at surveys, people say, oh my gosh, I wish I would have called sooner. So I can't stress that enough. Call. You're dealing with serious illness, wherever you're at in that stage, more than, especially if you don't want to call for yourself, call for your caregiver, your loved one, because sometimes we don't realize how much of a burden and how much they're carrying in this situation. This is much as a care for that patient as it is for that caregiver. So call much sooner than later.
When we think about calling, I'd love to end us with a story. There was a patient's loved one who had not spoken with the one that we were providing care for many years. They wanted to, but the one in our care was unable to speak, unable to communicate for a while. And through a tremendous effort of several team members, at the end, the final couple of days, that loved one in our care looked up to the child and said, I love you. And so I just want to encourage listeners that no matter how long, how hard, how unknown, how whatever it might be, we are here and we genuinely care about creating more of those I love yous, more of those supportive times. And that person looking back said, you know what, that changed my life. I needed to hear that. I needed to know that everything was okay. And we provide grief services. And sometimes you may not necessarily have the ability to have that closure, but we do have grief support. And grief support can help you throughout whatever stage you are in the grief process, because we realize you're going to feel one way today, you're going to feel another way a year from now, and it continues. But we're here for you. So please reach out, contact fourseasonscare.org, just simply by going on the website or calling our number. We care about you, and we're here to provide trusted care to everyone in need. Thank you so much, Chris.
Thanks, Millicent. And thanks to the Four Seasons team, the staff. They're an amazing group of people, and I love them for the work that they're doing, and keep on doing the great work that they're doing. Thanks for having me today.
Thank you.
The Quality of Life podcast is produced by Four Seasons, the care you trust, providing award-winning quality hospice and palliative care to Western North Carolina. For more information, visit fourseasonscare.org or call 866-466-9734.